brave girl now. On whom we're going to do revision rhinoplasty, and we're also going to do jaw sculpting with genioplasty, plus a buccal pad fat removal. What are her objectives? Objective is to get to this double chin that she has, better proportions to a lower third of the face, better projection to the chin, more angular lower third of the face. The revision rhinoplasty to correct the issues from the earlier rhinoplasty that she had in the city of Bangalore in South India almost a year ago. We're going to get the dorsum straight. Dorsum, there's a little bit of deviation. More than that, the dorsum is very broad. So we're going to correct both of these issues. We're going to do revision tip work and a little bit of asymmetry as you see from the basal view. So all of that plus a buccal pad fat. So that's what the plan. I just asked her if she was feeling scared and she's like, no. And we're just going to start the surgery now, right? Okay, you have any worries or anything? Nothing? Excellent. Thank you. This is after we've just intubated. We're planning an advancement genioplasty in both the horizontal and vertical dimension to increase the facial proportion. At the same time, do jaw sculpting to get a nice V shape. A little bit of submental lipectomy after I do the osteotomy and advancement. We're planning augmentation both in the horizontal and vertical dimension for this patient. So we've just completed with this genioplasty, has been both horizontal and vertical advancement genioplasty. So I'm going to show you the vertical advancement that we've achieved. So that is 10 mm vertical advancement. And I'm going to show you the horizontal advancement. So that's the horizontal advancement we've achieved. And that corresponds to 6 millimeters. So we've got a vertical chin augmentation by 10 millimeters, horizontal by 6 millimeters. So I've also got some contouring happening to make the chin more angular, more shapely, more suiting a girl who's in her 20s. So we've contoured the chin, advanced the chin horizontally by 10 millimeters, vertically by 6 millimeters. Jaw sculpting done to give the patient a much more angular jawline. Also remove a little bit of fat from the submental region because you're also correcting a double chin this patient had. Dorsum is wide. There's a little bit of asymmetry as well if you see from this angle. The position of the tip, the alar base, the dorsal aesthetic lines, all of these don't fall in the right way. So I'm going to correct all of this. That's the immediate on the table result for this revision. The tip is in the midline, the tip is pointed. As you can see, the dorsum is nicely defined, dorsal aesthetic lines are perfect. There's a gentle curve from the eyebrow. So hi, this is less than 24 hours after we've done rhinoplasty. That was a revision rhinoplasty that we did for her. Along with that, we also did a genioplasty and jaw sculpting. We've got the chin forward by 11 millimeters. We've got the chin vertically augmented by 6 millimeters. We've got the jaw inside for a V shape. So it was a major surgery. It took about 3.5 hours in all to finish the revision rhinoplasty and the chin. And we're going to find out from her how she's feeling. Is it very painful? First question. Not much pain, right? Yes, there's no much pain because we're giving her injections, she's getting medications, and obviously, as I keep telling my subscribers that the patients don't have pain, it is a fact. When you do look at these videos, it is painful. It looks sometimes really painful. But because we give blocks and because it's done under general anesthesia with good sedation, a lot of our patients, most of them do not have pain in the immediate recovery. Okay, but they do have some other issues, right? And we're going to get to find out what those are. Are you feeling like your nose is blocked, right? So you're feeling your mouth is a little dry. So this is a common thing. The mouth feels dry, especially when we're doing combination of rhinoplasty with other facial procedures, whether be a face makeover or orthodontic. So the dryness is there. It will be there for 3 or 4 days. Okay, when we remove the nasal pack, usually 3rd or 4th day, you feel absolutely fine with that. Right. The next thing is about diet. So we usually put them on liquid diet initially for the first 24 hours, and then we put them on soft solid diet. So you've been having only liquid stuff, right? Yes. So she's just had liquid stuff till now. Plenty of fluids, plenty of water, plenty of juice, about 2.5 liters per day. Right? That's the first thing you're doing. After that, you can start on idli. Salt, slowly, okay? You're not going to munch fast because we moved the bones. So the next thing is soft solid diet. Usually we keep them for soft solid diet patient like us for 2 to 3 days. Slowly we'll put you on rice. You can get back to not really hard food, but little bit more, chewable kind of food. So that's the third phase, and by that time we remove everything. We'll take it off after 4 days. Then you'll feel really comfortable. After that, usually patients are very fit, very fine. Yes, there is some bruising sometimes. There is some swelling here and there. But they don't have any issues after that, and then they're good to go. So that usually takes about 6 days. So like I said, 6 days that will also be done. Now, you have any concern, anything that's bothering you, anything you want me to ask, you want to ask me? Any pain here? No pain there also. I asked for pain here in the throat because of the anesthesia. They put the tube in. So some of my patients do tell me that there is some pain there for the first few hours. She doesn't have, so it's good. Did you see yourself in the mirror? You did? Okay, and how was it? You happy? Because, it's different obviously, and it's really come out very beautiful. Okay, I've done a little bit of fat removal also from here because you had the double chin. So I've done the fat removal of here from inside the mouth. It's possible. So we can remove the submental fat. In fact, people are now even doing thyroid surgery from inside the mouth. So I did some of the fat removal, and then we also got the chin forward, vertically down. We removed some of the bone here to get this shape. So all of that was good. And we could manage without harvesting rib also for you, because the earlier surgeon had harvested the rib, but wasn't, positioned in the most appropriate manner. So I've kind of reshaped it. So nose also, it's come out well. We've also reduced a little bit of the width here, given a nice tip, a suppurative break.
I won't get any breathing problem after doing.
No. Once you remove it, it'll be perfect. Okay. You will not have any breathing problem. Okay? Right. Take care. So this is usually the experience of a lot of our patients that undergo even major face makeover surgeries, bi-jaw surgeries, bi-jaw with rhinoplasty, various genioplasties with jaw sculpting, or angular osteoplasty with jaw sculpting, cheek contouring and jaw sculpting. Many combinations are being done, but the recovery is kind of similar for the bulk of the patients. No pain is what most of them say. They do have some issues with terms of breathing and, like I said, diet. Thank you. Hi, I'm Dr. Sunil Richardson. This is a patient day 6 after revision rhinoplasty. We also did Genioplasty with jaw sculpting to remove a double cheek, double chin. I've removed some fat also from here from the submental region. I've also improved on the cheek, given her a much more angular face. We've done some cheek sculpting, buccal pad removal, and rhinoplasty. What's a revision rhinoplasty? You had your first nose job done 1 year ago, right?
Yes.
And that was done in the city of Bangalore. And she had a lot of concerns with that. We're going to show you in a while how she looked before. But first, we're going to take off this sticky plaster. Okay, so that's her nose now. You can see it's very, very proportional. Can I look? What do you think? What do you think? I'm going to just clean up all this. You can see her before and after. What do you think?
Yeah, it's nice.
So you see that on the other side? So you see we've removed all of that fat. I've got the chin forward. We've increased a little bit of the height. I've got your face angular. A lot of fat there has gone inside. Nose was deviated. And we've got that deviation fixed. We've got it narrow. We've got a nice dorsal aesthetic line. Okay? A lot of work has been done. No. And so you see the angle the chin is making from the neck there, and see the angle chin is making in the neck here now. And there's some edema there, but it's got a much better angle. You can see that. And this is the up basal view. So we've got a nice slender nose. Okay, and down. And sorry. Yeah, there's some glare, right? Is it okay? Show me this. Okay.
Putting the shadow on.
Yeah, we need some light on the. Yeah, this is better. Look here. Look up. Yeah. So we have a similar view. So that's before and that's after. Jaw sculpting, genioplasty, revision rhinoplasty, cheek sculpting with buccal pad removal. And you can see the improvement that we've got. You can see the changes that we've got. She already had a rhinoplasty, as I mentioned earlier, 1 year ago in the South Indian city of Bangalore. And this is what we've done to her now. This is day 6. So this is day 6. We've just removed the sutures also for her, and she's good to leave. She's gonna leave us tomorrow morning back to Bangalore where she came from. You happy, right?
Yeah.
So what did I tell you to do? Smile. Yeah. One of the reasons why she can't smile is because we've done jaw sculpting and procedures around the muscles. So she's a real sweetheart. She's trying to smile, but she can't smile. But you can see the amount of improvement that we've done. We've gotten the lower third of the face totally fixed for her. This huge double chin has been removed. I've got the genioplasty jaw sculpting. You can see the angle now that we've achieved. And we've also done a revision rhinoplasty. This nose shape is also bent, it's broad, it's deviated. All of that has been fixed in one go. We've also done a little bit of cheek contouring here and here. So you can see how she's got a nice cheek prominence. And there's a little bit of a chisel inside aspect there. And then you have the lower border. You're happy, right?
Yeah.
And you're not having any major pain? Okay. Thank you. You want to say something? Nothing. She's very shy, but I'm happy that at least you agreed for this. Thank you.